Hi everyone, Danny from the CBAA here. Thank you so much for your early arrival for today's webinar, Connecting to Communities, Mental Health in Your Station and Community. Now, during this time of physical distancing and heightened anxiety in our communities, it is imperative that we ensure that looking after mental health is a priority. While our connection with our communities means that we're in a position to help contribute and foster a positive mental health environment, before we attempt to assist others, we first must make sure that we ourselves are monitoring and constantly trying to improve our own mental health. This is an issue that is as sensitive as it is serious. Our webinar today is hopefully going to look at building a positive environment at your station, best practice, and what organisations can assist you to assist others. Now, before I introduce our guests, still struggling with the Facebook Live, trying to get it there. I am recording this session, so it is available for people to watch afterwards. Oh, come on, you. Why won't you just connect? You know what? Millions of people can potentially see me on Facebook right now, struggling with Facebook. So that's obviously a very exciting thing, isn't it? Now, I'm seeing myself on Facebook. Kim, you've obviously got your camera on and your mic on. Hopefully that's all working. You know what, let's assume that it is. And you know what I can do? I've got two devices going at the moment. I'll get my third device happening and see if it shows up on my personal Facebook. This would be very clever if it does. All right, that's obviously not working just yet. Apologies, everyone. We'll get this happening in just a second. Obviously, everyone's sort of making themselves familiar with all of the functionality of the webinar, which is very much appreciated. That's sort of where you can go to ask your questions. And that'd be Adam coughing there. Thanks, Adam. Let's just let that go live to Facebook in the background. Kim Borrowdale, thank you so much for joining us, a change communication specialist, storyteller by trade, who for the past 20 years has worked across public, private, and not-for-profit sectors, delivering change management projects and communication strategies in Australia and around the world. Previously Deputy CEO for Suicide Prevention Australia, Kim now lends her expertise to socially conscious organisations such as Are You OK? She's, of course, a proud director. Well, many people will know Kim for her involvement with the Community Broadcasting Foundation. Kim, thank you so much for joining us here today. Also, you'll see there amongst your group of presenters, Adam Stokell, the station manager from Heightened FM. Heightened FM are in Bowral, in Mittagong, and they are having a banner year in 2020. Just like everyone else, they have sort of had to deal with the fact that the world is somewhat unravelling around us. But they have been there for their community. In addition to Adam steering the good ship Heightened FM, he's also begun to contribute several articles to the Highland News, the local newspaper there, and these are articles that are spreading far and wide via the publishers of that newspaper. I don't know if this is your most recent article, Adam, but it's time to talk about mental health this October. It was an article that Adam recently penned. He continues to do a lot of great work in the space of mental health, and that's why we're very honoured to have him here as one of our guests this afternoon. So thank you very much, Adam, for joining us. I will just stop sharing my screen now. Let me stop sharing it and we will get things going. Kim, thank you so much for joining us. Was there anything there in the introduction that I gave to you where I missed anything of great importance?
Thanks, Denny. It's really great to join you today. I've met many people from the community broadcasting sector through my role at the Community Broadcasting Foundation, but today I'm here to speak about my day job, which is working in the mental health and suicide prevention sector. So hopefully some of the lessons that I've learned from organisations I've worked with over the past many years will be helpful to you today, and we can stay in touch and through the CBAA if we need more information shared after this as well. So thanks for having me.
Thank you. Adam, anything in the introduction that I had for you that I might have missed out on, mate?
No, I think you summarised it well. So, thank you for having me.
My pleasure, mate. This is going to be a different sort of session than the webinars that we usually present here at the CBAA. We do sort of do a lot of people talking to slideshows, but today we're going to try and personalise it a little bit. We're going to be there on camera, on your computer, just asking some questions. I have a whole bunch of questions that I want to put forward to both Kim and Adam, but as always, we invite all of our participants and attendees here today to put forward any questions that they might have. Anything that you want to get started with, we would be happy to answer those questions. And I'll get things started now. Firstly, and this is for station managers, but indeed it might sort of apply to everyone who's there in sort of position authority at a station. What information, firstly, is helpful for station managers to know and be aware of to make sure that mental health is being looked after at their station?
First of all, I just want to recognise that it's a tough time for everyone at the moment. So people are in different situations. We've already had Daryl online from Melbourne in experiencing lockdown and other restrictions, but all over the country, the context that at the moment, the likelihood of people answering no, I'm not okay to the are you okay question is probably more common than ever, because everyone, not only do stations have the pressures that you're facing, but every single person working within a station will have other pressures. So at the moment, people are trying to balance childcare, have job pressures, whether that's related to the station or other day jobs that they've got. There's the anxiety around COVID and the uncertainty in the world at the moment, and the social, physical restrictions, how people stay connected, and obviously community broadcasting more important than ever for people to stay connected at the moment. So I think what it's good for station managers or people in responsibility for management within the stations to understand is just to, no matter what pressures you're facing as a station, is to remember the wider context for people, that people are coming into your lives and your operations with a lot of other stuff going on in their minds. So there's some great resources actually at Are You OK? So this year the theme for Are You OK Day was There's More to Say After Are You OK, which really acknowledges the fact that we're pretty good as a country checking in on each other and asking how we're doing, but a lot of us, the research that Are You OK has done has shown that while people are very willing to ask, are you okay? A lot of people are uncertain about what to do next if they're not okay. So there's some great conversational resources online on areyouok.org.au that'll just help you if you come across these, because I think as station managers and management, the likelihood that you're having those conversations that are about more than station business are pretty high at the moment.
And where would you send sort of station staff and volunteers if they have questions related to this beyond the Are You OK site?
Yep, so you can check out the Are You OK site. Also, what a lot of people don't know is a lot of those helplines and crisis lines, you can actually call them if you're worried about someone or you want to talk through how to approach something. So for example, Beyond Blue's got this extra coronavirus support line at the moment. So you can jump on a call with a counsellor. So say if I'm working in a station and I'm worried about a staff member, and or I'm not quite sure what to do or how to start that conversation, I can look at resources like Are You OK and do my own desk research and use some of those conversation tips, or jump on one of those helplines. So Beyond Blue, the coronavirus support line, there's a lot of other mental health services and suicide prevention services that perhaps we might share out later, Denny, after the webinar, is that you can actually talk to someone about how to approach a conversation. So it's very much focused about the people around the people who are struggling. So if you in a position of station management are worried about a staff member or someone in your life, then you can actually reach out to one of these helplines and say, look, this is the situation I'm in. I'm not quite sure how to approach it. I'm not quite sure what to say. I was thinking I've done some research and I think this might be the way to start the conversation, but I'm not sure. So really use those as a sounding board. That's why they're there. They're there to help you, whether you're struggling with something yourself or struggling to support someone. Also, I would suggest particularly for stations themselves, there's some great resources for small businesses on headsup.org.au. So that's specifically developed by a range of organisations to have resources for workplaces. So you can do things like there's quizzes to have a think about your mental health of your employees and your volunteers. There's some resources and all sorts of different checklists that you can download for free. So headsup.org.au is a really great free resource, particularly for workplaces.
We're very lucky in this country, aren't we, to have all of those people sort of manning those support lines as well. It's wonderful sort of being able to have that there in the background to be able to direct people towards them. Where do you sort of start in addressing workplace mental health issues? Sort of, you touched on before about the theme for Are You OK Day to Day, sort of asking Are you OK, and following up with that one. What's the most sort of ideal sensitive way that you can go about addressing these workplace mental health issues?
Yeah, so Are You OK has a really great model called ALEC, which is really easy to remember, ALEC, which is ask, listen, encourage action, and check in. And so I think when it comes, it's thinking about each of those steps. So before you ask, so for example, in a workplace situation, particularly when we're not physically with each other a lot at the moment, is thinking about what's an appropriate time and place to ask. So maybe it might be that, for example, you might notice that something's not quite right with me. I'm a bit more quiet on the Zoom call or not as engaged in the team meeting. A group situation like this would not be an appropriate time to ask me how I'm going. Maybe perhaps asking if we can, sending me a message and asking when's a good time for me to chat, and saying just simple things like, I've noticed some differences in how you're acting, or you're a little more quiet than normal. I was wondering what's going on in your life, or did you want to talk about anything that's going on in your life? Another thing is putting those, you can try and ask the question in the context of what you know is going on. So for example, you might say, the stress of COVID is really getting to me at the moment, and I was wondering how you're handling it. Is what's going on for you? Is this creating a greater sense of anxiety for you, or what sort of stresses is this creating for you? So just really thinking how to ask rather than, I know this Are You OK it's a very simple, powerful question, but you've really got to think about how to ask that question. So then the second step is to listen. Now, this is the one my nana had, that saying that I'm sure everyone's heard, you've got 2 ears, 1 mouth, use them in the right proportion. And that's something I always need to remind myself of. But when it comes to asking someone, if you've noticed something's not quite right with someone, listening is so important. You don't have to have all the answers to what's going on in their life. You don't have to solve their problems. And I know as human beings, it's our nature. If someone comes to you with a problem, you're like, right, how can we fix this? Let's get them onto a helpline. Let's sort out their problem. Let's do A, B, and C. But actually, the feedback that we get from a lot of the organizations that I work with is often people just want someone to listen, and listen without judgment. And just be open to hearing about what's going on, and that often is enough. They just need a friendly, open ear first of all, and an acknowledgement that there's a problem, and that together we could try and have a go at that problem, but that you're not there to solve all their problems. You're there to walk alongside them and listen. The third step is encourage action. So this is if you think, the problem is too big for the both of you. Like maybe you do need to seek out a support line or go with them to the GP or something like that. This is when few questions that we would suggest asking is actually, it's all about exactly what you talk about in community broadcasting is giving people that agency to own their own decisions, own their own community, their own lives. So a good way to approach that, even if you think someone needs some extra help from a mental health professional or some other service, is to ask them what they think would help. So, so that you're not just taking this person to a place of help. You're asking them, you know, I know there's a few helplines available. I go to my GP if I need to talk about something that's going on with my physical or mental health. Have you thought about what might help you in this situation? Have you thought about what sort of services might be available? Do you need a hand to research some of the options? Because I think this problem might be a bit too big for you and I to handle. So encourage action. And most importantly is the final step of ALEC, ALEC, is check in, because we know, particularly with what we're living through at the moment, that these are long-term issues. So there's complicated problems. Things like the environment we're living in at the moment throws up stuff about jobs, relationship pressure, you know, things going on in your family, things going on with your work, things going on at home. So it's long-term complicated stuff, and it's really important that, and to recognize that people do go up and down at the moment. If someone talks to you about something going on in their life, then check in and say when you're going to check in. So perhaps say, okay, thanks so much for sharing that with me. I'll pop around tomorrow and just see how you're going, or I'll give you a buzz tomorrow and just check in to see what you're up to, or follow up perhaps next week and see how you went with your GP or with the call to the coronavirus support line, for example. So really important to check in. So ALEC, it's a very good acronym to remember: ask, listen, encourage action, and check in.
And I've put links to a couple of the Are You OK pages there to do with ALEC into the chat box at the moment. And I do need to apologise there. When you were there on L for listen, I nearly spoke over the top of you. So there I was sort of making one of those mistakes that can be made in regards to that. A lot of discussion at the moment, and you touched on it there, with sort of everyone's working a lot harder with COVID-19, is of course work-life balance. Now that was the thing that was a lot easier to deal with before it was 2020. What are the signs where there might be an imbalance there with work and life that you see in the workplace, like sort of a burnout and so on and so forth? And what are the tactics to help circumvent that from happening, and do what you can to support them?
Yeah, there's been a lot of discussion about, you know, with people working from home as well, where they haven't been able to get that regular social connection physically in the office or in the station. Some stations have been able to just go back to being in the station, but some are still recording remotely, and some volunteers maybe are immunocompromised, so are not able to physically go into the station. So yeah, people are really missing that social connection. Also, it's hard to get a read on people sometimes when you're talking online. And also it's difficult for people to try and delineate between work and home. So I've heard about some great techniques of people to try and draw a line between that, to the point where one colleague of mine actually would get dressed for work in the morning and walk around the block and come back in the house and start their work day. And then at the end of the day, they do the same thing and walk around the block and come back in like they've come back from work, which sounds silly, but actually that works for her mentally to make that break between work and home. But I guess it's the big thing is actually just noticing if people are acting differently to their usual behavior. So if someone's saying that they're a bit overwhelmed by work, or they're struggling to get some of their work done, you know, it might not be that they just haven't got time. It might be that they're actually feeling a bit overwhelmed by other stuff in their life. So I think it's more important than ever to try and have those check-ins. If you're a manager or a colleague, have those informal check-ins more regularly. So even if it's just a quick phone call or a text, just to check in before you get to burnout stage. I think, you know, burnout's quite an easy one to recognize because they've hit a point where they really, really obviously need help, but you want to try and catch people earlier on so that we can avoid as many people as possible getting to that burnout stage. I think encouraging informal check-ins, maybe even a buddy system, so it's not always a manager and staff member check-in. So maybe have assign some volunteer buddies, perhaps, to just text each other once a week or something. Just about, it doesn't even have to be about work or about the station, just informal check-ins. Another thing is people are really benefiting from the social aspects, like trying to be creative in how you actually spend time together as a team when you don't have the normal chat in the tea room, or you don't have your nights out to dinner or what have you, is thinking what activities or what ways can you be a little bit creative about team building as well. So, you know, you get all the usual stuff around, you know, a quiz night, Zoom trivia. I know you've been doing the trivia nights. So thinking about that at a station level, what's some stuff that you can do that just to even just jump on a Zoom call after work for a, you know, happy hour chat, for example. You talk about something other than work. So just try and think about things that you can put in place pre-burnout, because I think burnout shows itself pretty clearly, but it's the steps beforehand that are important.
Excellent, and doubly important for community radio, because obviously a lot of people do get involved with the sector because of a need for connection. Adam, you're there in the background. Those questions there in regards to sort of addressing the workplace mental health issues and trying to pull up on or identify and try and assist with any burnout that might be happening there. Anything from a station manager point of view you'd like to respond to that?
We've been quite fortunate. Sorry, thank you, Danny. Thank you, Kim. Good morning, everyone. We've been quite fortunate at Highland FM. We, I think, like the CBAA, we have an internal communication system via Slack that we will have, obviously, our general chatter. We also have fill-in and station news. Having those channels allows us, I mean, obviously not working in a office environment where we don't get to see each other on a regular basis. It is our number one point of communication. And you know, having a fill-in channel, for example, if any of our presenters are unwell physically or feel a little stressed with COVID-19. I mean, with the COVID-19 pandemic, Highland FM continued to broadcast in studio. We have a very strict COVID-19 hygiene policy, which allowed us, you know, with good governance and policy to navigate our way through. Having that internal communication system, whether that be chatter or general, or in particular the fill-in channel, really allowed our presenters to look after one another, which was, you know, very important for us through the pandemic. Look, I think it's a matter of just being there for one another and supporting one another and being active. I mean, yes, we're a volunteer organisation. We are a cooperative in the true sense of the word. And so, look, I think that's what has been very beneficial for us is having that internal communication system, Slack.
Excellent. Thanks very much, Adam. I did have a question here about sort of how do you measure the mental health of station staff and volunteers, but you've possibly answered that there in regards to identifying burnout before it happens. Is there sort of anything more on that you'd like to touch on before we move forward, Kim?
I was just thinking in terms of measurement, is a reminder just to check out that website headsup.org.au, which is specifically for small businesses, because it has a few tools and techniques there where you can actually do a bit of a temperature check on your organisation and then think about what plans you can put in place. So it's less of a sort of an individual immediate, how do I deal with this, but more how can I look from an organisation perspective. That's a really useful one to look at.
Excellent. I'm just going to get the link for that now and put that into the message box. Further to that, of sort of all of the great resources that you're talking about here, where would people go to for courses and education on mental health? I understand there's a mental health first aid course.
Yep. So there's heaps of courses available to learn more. So you've got some literacy courses like mental health first aid, where you can learn more about you know, reducing the stigma and about different mental illnesses and get a better understanding of mental health in Australia or around the world. Actually, it's an international course. You've also got a program programs by LivingWorks, which are suicide first aid programs. So if you think about, in most organizations, actually volunteer organizations specifically, like surf clubs and sports clubs, you do your CPR training with St. John's. So LivingWorks is a company that's essentially the suicide first aid version of that. So you learn about how to spot the signs when someone's life's ups and downs, it goes beyond just the sort of usual life's ups and downs, and where you might need to ask them directly about thoughts of suicide, for example. So what I think is a great place to start, because, there's so many of these courses, and I could send you to all different websites, but a really great place to start and to get it, because I know that a lot of stations and everyone around at the moment is pushed for budgets, is get in touch with your local council, and local Lifeline are good ones, because they often have free training courses. So I know, for example, I live in the Northern Beaches district. Radio Northern Beaches is my local station, and I know that I was speaking to a volunteer on the weekend, and he's joined the Suicide Prevention Network, which is a initiative by Wesley Mission, funded by the local council. But essentially that means that he's now on the mailing list for this network, which means he gets told about all the free training courses that are coming up and all the funded training courses. So my biggest tip for stations, and you all usually would have a great relationship with the council already, right? So I think making it known to them that you're interested in training for your staff and volunteers, I think they would love to give you access to that. I think you could also offer to promote those courses so that you can get other members of the community involved in registering for those mental health and suicide prevention courses. So I think start with your council, see what they've got going on. Local lifelines often offer free training, as do primary health networks. At the moment, actually, in Melbourne, LivingWorks is offering via 2 primary health networks free LivingWorks Start training, which is a 90-minute introduction to suicide first aid. So if you have a look on crisisheroes.com, you can access free training via that website. But yeah, I think start with your council and see what they're offering. And I'll also give the details of a couple of those organisations to you, Danny, so we can send them around to everyone after. But yeah, it's a lot to navigate, I understand. But the Heads Up website's good for workplace training, so get on there and have a look at that. But otherwise, hit up your local council for free training and potentially advertising.
Excellent. Good to have that as well. That'll sort of help things out as well. There's a quick question in here from an anonymous attendee. I know that you answered the query that was in there from Daryl at Positive Media in Melbourne. Daryl, thank you so much for writing with your question, and obviously everyone else, we would encourage you to put forward your questions as well. This question is, I've been involved with community radio in one form or another since 2005. Discussions about the future of community radio have always lurked, but they seem more relevant and prevalent than ever. Part of that is because there are so many content-making platforms widely available to the community now. I don't want this to sound like a cynical question, but I suspect it is one that lurks in the back of many community broadcasters' minds. Given the many rules and regulations, especially around monetisation in community radio, that do not now exist for many new platforms, is it time for a big shift in how community radio operates, or will this ruin the integrity of community broadcasting? Now, I'm not going to ask you to respond to the parts of that question that deal with sort of where the future of broadcasting might lie, but I think with that question, it very much touches on the mood of 2020 is very much sort of, there is a great unknown after this year. I think there's sort of people with all aspects of their work. There's a lot of questions there about what the future of that is going to be, because sort of when is JobKeeper going to run out? Is the industry that I'm in going to sustain itself long enough to do all of that sort of with the day-to-day stuff? How do we, when it's sort of, when it permeates sort of every element of your existence and it sort of looks like the nearest part of your future is this big cloud, sort of what can be done about that?
I think, sadly, community radio is not alone in this. You have two modes at the moment. One is immediate survival, like, in every aspect of our life, no matter what industry we're working in, we're thinking, how do we survive now? How do I make every angle of facet of my life thrive as much as possible in a very difficult environment? So you're very much now, whilst then thinking, well, what does this mean for the future? How can I future-proof my work or my environment, my family, the life I want to live? So you're constantly caught in this world of making the now work and thinking, how can I predict what the future is in a world that has shown itself to be quite unpredictable and shaky right now. So I think I obviously don't have all the answers to the to the sector questions and the philosophical of where are we going. But I think what's important is to just acknowledge that that's where we're at. Like, it's a very anxiety-ridden situation, and it's okay to just acknowledge that this is the stuff that is running through our minds. And even if we feel like we're coping with stuff okay, and we're sort of sitting in the emotion of the world at the moment, we seem like we're doing okay, you can't deny that everyone's mind's going 1,000 miles an hour in some way about something, whether it's a current stress or a future stress. So I think from a mental health perspective, it's actually just calling that out and saying that everything that this person's brought up in this question here is on everyone's mind, and things are uncertain. So I know there's work being done from a sector perspective on shifts in the sector and in the future priorities. But just on a personal front, I think it's important to just recognize that we're all living in that reality and in every part of our lives. So I think it's knowing when the lurking bit of your mind overtakes you living your life, then you need some extra help to just talk through it. And again, who you talk to might not have the answers to that question, but at least they can help you sort of slow the panic of those thoughts and slow that anxiety, and help with some coping mechanisms on how to manage what you're managing now and every day, and how to manage that future stress, and put some steps in place to just be able to work on that in a more sort of calm fashion, rather than getting caught up in the what ifs and the whys and stuff like that. So I think one thing is to acknowledge it, but the second is knowing when you might just need a hand to just really get through those thoughts in your head.
Thank you for that, because I won't lie to you, that is a thing that sort of weighs heavily on my mind as well. Now, I'm just going to start sharing my screen at the moment, and here you'll see an article from the Highland News that's in Bowral. It was authored by one Adam Stokeld of Highland FM 107.1. Adam, you want to sort of give us a bit of a rundown as to what your station has planned? Of course, October is Mental Health Month.
Yes, it is.
And just sort of wondering what you guys have planned.
Let me start with our motive. This isn't about promoting Highland FM. I'd like to read this as I don't want to miss anything. A mental health emergency has erupted in Australia. Now, people are dying at a faster rate than the pandemic COVID-19, and this is a silent killer. It's depression. It may manifest itself as loneliness, anxiety, or stress, and it's taking lives, in many cases, young lives. This year, we have reached unprecedented levels of suicides and worse. They are predicted to increase by 25% each year for the next 5 years. That is over 750 extra deaths by suicide a year, which again is a far bigger death toll than COVID-19. Our community radio stations can do something about it. Something is better than nothing. By doing something, we can make a difference and even save a life. Now, our communities are not immune to this mental health crisis. Every day via community radio, we are reaching our listeners. We may be the only voice some people hear in hours, days, weeks, maybe longer. We can help raise a smile, offer friendship and comfort. We can help by encouraging conversation to be more open about anxiety, depression and loneliness. And we offer information on how to get help. Yes, we can do much to reach out to those who are struggling and feeling isolated. Community radio also brings awareness to our listeners who are less vulnerable. They too can play a role in helping others. Mental health problems affect 1 in 4 people, and we're all capable of noticing the signs of sadness, depression, or anxiety in those who are near to us. We, Community Radio, has the means to do something to help fight this battle, and we do not have to do it alone. Heightened FM has picked a team to help us in this fight against depression and suicide, and to bring awareness to mental health issues in our community. Working together, we have achieved much. We have achieved positive, tangible results. Now, our team is our community mental health support organisation, Community Links, and Reframe for youth mental health, and our local Fairfax paper, the Southern Highland News. We provide mental health professionals a platform to reach our listeners on air with information on mental health issues, with advice and encouragement on how to seek help. Now, this month, it's October Mental Health Month in New South Wales. For our community, we have titled the campaign, Time to Talk. Our format is to kick off the promotion with an article in our local paper, Fairfax Southern Highland News. We have scripted and produced a community service announcement. We have facilitated interviewees for our presenters. Community Links Reframe will be handing out information on mental health from pop-up stalls located throughout main streets and shopping centres in the Southern Highlands. Southern Highland News will publish weekly articles, which allows us to engage with an audience outside our usual parameters. Social media, via Facebook and webpage, also provides further awareness. We have followed this format previously with COVID-19, tightening our connection with the community, loneliness, connect with others, could a pet rescue you from loneliness, our July Kind Hearts campaign, try a little kindness, and what does kindness mean to you? There's more to say after Are You OK? And this month, it's time to talk about Mental Health October. I guess in summary, doing something is doing a lot.
Excellent. Thank you very much for that, Adam. I will also, I've got links here amongst all of my emails there about a lot of the stuff that you'll be doing, and I'll include that in the follow-up that I'll be sending out here now. Hopefully you I might be getting to the point now. Don't tell you people there at Highland FM, but I'm probably Highland News rather. But I'm probably getting to the point where I'm going over my free articles per month. So sorry about that one. But wonderful to see all the stuff that you're doing there. I think you raised a really excellent point there in the article about sort of how people perceive mental health, where it might sort of be, if we were to look at it sort of equivalent to physical health, where it's not sort of something that we need to be scared of. It is just sort of something like having a broken bone where you need to do what you can to make sure that it heals.
Yes.
And can I just say to Adam, it's so great what you're doing there. Like you really can make a difference, and everyday Australians can make a difference. I think that's what I've learned from lots of the organisations I work with is you don't have to be a health professional. Yes, there's a place for health professionals to help you, and help those around you. But in the most case, it's just everyday people keeping an eye out for each other. And some of those stats are really scary. And I know that there's a lot shared around social media with those predictions around the increase in suicide and things like that. But what I want everyone to know is that they are just predictions if we do nothing. So yes, those numbers are not our future. If we can put in place training and education, awareness, community connectedness, there's so much stuff that think people other than us have responsibility for, like government support and economy and housing and stuff like that. But there's a lot that's in our power as communities and individuals to help protect each other from those numbers. So I just want, if one people can take away from that, the actions that Adam's talked about there, is that those numbers are only if we do nothing as a community. Whereas we do have the power to change and save lives by taking simple individual and community action.
Excellent. Well, you've preempted my final question to you is going to be, what is the key takeaway for the community broadcasting community for Mental Health Month?
I
my
did.
mind.
I
I've
don't
seen
think
this
we
one.
answered one question though, Danny, about social media. Was there one other one there about an employee noticed that a sponsor had been active putting negative posts on their on LinkedIn, for example?
Yes, I'll read that one out to you if you'd like. That one is from Daryl, and yes, you've got most of it right. An employee noted this morning that a sponsor had been very active on LinkedIn in the past few days. The comments are getting more and more negative and being posted late at night, i.e. I'm finding it harder to sleep at night and feeling down. How should I support our employee and the sponsor in this situation? I've suggested not to respond on social media, and also noting that the employee does not know the sponsor very well, but still obviously wants to do what they can to try and assist.
Yeah, I thought that was a good one to address because a lot of us, a lot of people are managing social media. So, you know, you might get people who are sharing their personal situation with you. So I think it's good if you don't have a relationship with that person to not respond not respond to them one-on-one, unless it's an emergency situation. So if it's just generally they're commenting on their well-being, then I wouldn't recommend doing a public social media response. There's a couple of things you can do. One is, and this is a good lesson for everyone, is sometimes you're not the right person to check in on someone. So for example, in this example, the employee doesn't know the sponsor well, but someone else at the station might, who could do an informal check-in with that sponsor. So in this case, I'd suggest not doing a public response. I'd suggest someone who knows the sponsor, just dropping them a message, just saying, hey, I noticed these comments on social media, just checking in on how you're doing. It also might be a good time to do a general social media post. So sometimes if we notice, for example, at some of the organizations I work with, if we notice an increased anxiety on people posting their experiences online, instead of responding to every individual post, we up the level of posts that we make about support lines. So for example, you might share a story about how someone had a really good experience calling the Beyond Blue coronavirus support line when they were feeling anxious about COVID, and include the guidance. So then you're addressing the people on social media who might not post about how they're feeling, but might feel exactly the same as this sponsor. So that's a good way to address it both personally and publicly.
I guess that's coming more and more to the forefront, is it, as well, as more people sort of engage with one another via social media, you're having to learn and find out ways where you can communicate sensitively using that platform. And
it's just a matter of checking in with people because, look, it's not unusual to feel a bit up and down right now, right? So it may be that person's perfectly fine. They're just struggling to sleep at the moment, or they're just feeling a bit down today. They might be okay tomorrow. They might be down the next day. So it's really just checking in and thinking about who's the right person to check in.
Excellent. Now I'm just going to check the Facebook, see if there's any questions coming across there. Thank you to my colleagues who have via the Facebook been putting forward links to all of the stuff that you've been talking about there, and we've got so much more. All of this, of course, will be included in a follow-up email to all of our registrants for today's session. So that's not just people here who are live with us now, that includes everyone who registered and weren't able to turn up because they're obviously understandably very busy at the moment. So there'll be a whole bunch of resources coming your way soon. I'm in the process also of the CBAA website. We've, for many, many years now, made the CBAA website the platform for the Suicide Prevention Project, which is where we're talking to organisations that we've mentioned today, Are You OK, Headspace, Beyond Blue, all that and so much more, putting together community service announcements of varying lengths that stations can go to. You can download a whole bunch of new content, 20 new pieces every month, and you're able to play that whenever you want as a community service for your community, and it is really great audio and sort of helps build that tapestry of your station being one that has care and concern for your community. And so links to that will be coming as well, and that'll also sort of be there as part of the CBAA e-news. We are coming close to the end of today's session. I'm just wondering, Adam, Kim, you've provided us with so much fantastic information here. I know this is a topic where you could sort of we could probably do a weekly one of these ad infinitum. But is there any important stuff that we haven't touched on this morning that you would like to bring up?
If I could just add, the beauty of community radio is that it fosters a sense of belonging. It's a really important platform. And to touch on, I think, the question that was asked earlier, what have we done at Highland FM? It is just foster that sense of belonging, whether that be through our membership, our presenters, or through the wider community. We're all in this together. And I think that is what is really important. And together we can achieve more.
Excellent, thanks very much. Now, Kim, before I get your final thoughts, I do realise that another anonymous question has come through. The question about the E part of the ALEC
Yep.
thing that you brought up. If volunteers or employees have advised that they're not okay, what strategies can be put in place to work with them in regards to mental health plans in a respectful and supportive way without sounding like you're being nosy?
Good question. So the E is encourage action. So I think this is twofold. So from a workplace perspective, I think definitely go to headsup.org.au for different tips and strategies around how to do that appropriately as a workplace. But in terms of just interpersonal advice around that one, is I'd always go back to that person themselves, asking them. So if they've said they're not okay, then they have a good sense of what's going on in their lives. And I think don't take away their power in being the sort of solution to their own problems. So it's a really good way to say, what do you think would be most helpful? What sort of strategy do you think you should put in place? And how can I help you? Just simply, how can I help you? What can we do as an organization, as an individual, to help put some strategies in place to help you get through this? Because as Adam says, we're in this together, and it's really hard to say that you're not okay, but now that you've said it, let's work together to help you so that you can get through this next stage. But really put that question back to them so that they're able to own their own solutions, rather than you, as you said, nosy. You don't want to be accused of being nosy or coming up with the solution yourself. So I think asking someone what they think would help is always what I would advise.
Excellent. And was there anything that you would like to touch on that we haven't previously spoken of in today's webinar, Kim?
Yes. Now, it might sound a bit cheesy, but it is the number one in supporting other people with their mental health is actually taking care of yourself. You know, that old airplane analogy where they say with the oxygen, put the oxygen mask on yourself before a child or someone else vulnerable. Same goes with mental health. If you're really drained and burnt out and as much with the best will in the world, you're not in a good position to help other people. So really taking care of yourself and knowing what makes you feel good or what strategies you can put in place when you're not okay is really important. So there's actually a really good app called Beyond Now, which is by Beyond Blue. And it was developed, and actually it might be helpful for the previous question about strategies to put in place. It was developed for people who may have thoughts of suicide, and the idea is that when they're well, they think about all the different things that make them feel good or get them through a difficult period. So these could range from, who are people that I can call to talk about how I'm feeling? Who are three helplines I can call if things are really, really bad and I don't want to talk to a family member or friend? What are some activities that help me just interrupt some of those negative feelings? So whether it's a walk to the dog park or going to a cafe and things like that. What are some environments where I feel safe and it helps me de-escalate those feelings of anxiety or anything like that? So that's something that I'd recommend that every single person does, because it makes you stop and think. And I know that sometimes during this COVID pandemic life, we've actually had to have a look at our lives, right? And think about how our work-life balance is and how we're managing the different aspects of our life. But previously you just get caught up in the day-to-day and you don't actually think, what actually does make me feel good? When I'm feeling stressed, what helps me de-escalate those feelings? And so this app, Beyond Now, they call it having a safety plan in your pocket. So think about it, when you're feeling good, that's when you fill out all the things that you think are helpful, so that when you're not feeling so good, you can get that plan out, and it's super simple. And it just makes you think, actually, when I was feeling a bit more rational and a bit more calm in my thinking, I knew that all these things help me. So now that I'm not so calm, let me just refer to this and just think, okay, what steps can I go through? Who can I call? And I think just making sure you don't need to do an app. You could just write a list of things and just keep it handy of what things make you feel good when you're having a bad day. But you cannot support other people if you're not feeling good yourself. So I think number one lesson for me this mental health month is take care of yourself, whatever that looks like.
Excellent. That's a wonderful analogy. Thank you so much for that. Thank you to both Kim and Adam. Anyone looking to connect with either would be more than happy to pass on the details for both of them. Just flashing up now, our next webinar. The webinars have been coming thick and fast in the year 2020. The CBAA set a new personal best for the amount of webinars we've conducted. Webinar heaven here at the moment. Next Tuesday at 2 in the afternoon, Anna Chanella, a CMTA trainer and also active with Radio Skid Row here in Sydney, will be looking at project management tools and resources. That's tools, technologies and trends to ensure that stations are planning for their immediate futures as comprehensively as possible. And of course, beyond that, so much more online education coming from the CBAA. That's right, the 2020 CBAA conference. This year it's a virtual conference happening online from the 28th to the 31st of October 2020. The website that you can go to find out more about that will be one that I will, when I stop sharing this screen, and hold on, hang on, that's the wrong screen that I'm sharing. Now I have to share another screen. Sorry, a lot of screens to be sharing, and I've got to memorise what the name of this conference website is. It's conference.cbaa.org.au. That's conference.cbaa.org.au. All of the information there about who's speaking, how to book, the schedule. I love the little video there, letting you know how much fun the conference is. All of that available there at that website. Feel free to go and check it out. Kim, and also one thing, that because I was mucking around and futzing with the old, that's futz, F-U-T-Z, with the Facebook there at the start of the session, I neglected one of the most important things that we should lead off all of our public facing things with, and that's to acknowledge the traditional owners of the land from which we're broadcasting today. The CBAA comes to you from Gadigal land, and as such we pay respects to the Gadigal people of the Eora Nation, paying respects to elders past and present. So big apologies that I didn't get that done at the start when I was mucking around with the Facebook and whatnot, but that is sort of, for me, that's always one of the most important things we do with any of the public facing stuff that the CBAA does. Kim and Adam, thank you so much for taking time out of your busy schedules today to be involved with this webinar. All of our attendees, thank you so much for taking the time as well. It is very much appreciated. Owe you both a big time. Keep up the absolutely fantastic work. I think what you're doing is just wonderful, and that goes for community broadcasters as well. Not only can we be that comforting voice for our community, as Adam said, we can also be a place where people can go to for that connection, whether it's that place is a physical space or a virtual one. We're there for our communities. Look after yourselves and keep on looking after your communities. You're doing us all very proud. Thanks, Adam. Thanks, Kim.
Thanks so much, Danny.
Thank you,
Thank
Kim.
you, everyone. Thank you, everyone, for joining us. Hopefully, we'll be seeing you next Tuesday, and if not, then at the 2020 CBAA conference. Bye now.